Okay, Carol, I last spoke to you on Near FM around 6 months ago. Can you tell me how your organisation and the people you work with are finding the lock-in with the coronavirus?
It's causing an awful lot of problems. We are an advocacy group and we try and listen to what's happening on the ground, talking to people like the citywide drugs crisis campaign and talking to other drug task forces individually, and it's having a massive impact. People in addiction, they're vulnerable in very many ways: health issues, mental health, social marginalisation, poverty, being criminalisation, and stigma. So with the lockdown happening, it means that many of the supports that were available to them, such as structured day services that they could go to, or supports for their children or for the families, they're all gone. They might be homeless. They might be trying to manage their addiction in homes that are often crowded, where family relationships are under strain. So it really is having a major impact, and we're hearing of many people relapsing because they just can't cope with the anxiety and the stress of the lockdown.
I saw a report from RT News last week. They were in Crumlin talking to Addiction Response Crumlin, or ARC as they're called, and their manager and co-founder Susan Collins said in that report, this is over a week ago now, but she said that there's a real danger of more people who have addiction problems relapsing because there's a heightened sense of anxiety. And there was also a consultant from St John of God's in the same report saying that he expected there to be an increase in relapse. Go on, yeah. Do you want to say something?
Yeah, I think that they're talking the truth there. There is more people going into relapse, and we're also seeing with people locked down that we're seeing reports of huge increases in alcohol sales. So people who wouldn't normally drink harmfully, or people who are drinking harmfully, they're now drinking more because they're at home, and again, they're drinking to cope with the anxiety. So it's a very dangerous time for anybody who has an addiction.
I was just going to say that. Speaking personally, I think you know this, but I had a drink problem, and later this year I'll be off for nearly 10. I'll be off for 10 years. I did most of my Thanks. I did most of my drinking during the so-called Celtic Tiger years in Ireland. I don't know if you have an opinion on this, but it strikes me very strongly with all the troubles in the world today, with the coronavirus being the latest, but also other problems, that there's a big added need to stay sober and not get kind of intoxicated from drink or drugs, like just to keep your wits about you. Do you agree with that?
I think it's how you manage the drink. It's not necessarily about not drinking at all. It's about drinking in a low risk fashion, so that you don't drink enough, so that you lose your sense of safety and the need to actually do the physical distancing from people, or you forget to wash your hands. And these are the key things that are keeping people from getting the COVID virus. And unfortunately, the messaging that we're getting about the role of alcohol isn't clear enough from the government's messages. Like they're doing a really good job on communications and campaigning, but they're not getting across the message that alcohol affects people's respiratory systems. So you're more likely to get pneumonia if you're a heavy drinker. A lot of people don't know that. So if you're a heavy drinker, you're actually increasing your risk that if you do get the coronavirus, that you're more likely to have complications from it. And the government aren't getting that message across. And I don't know about your WhatsApp groups, but in my WhatsApp groups and social media, all I'm seeing is memes and cartoons about drink being the solution to everything. So I think it's not about being sober. It's about drinking within the low risk guidelines, so that you maintain your safety from COVID.
I think it's a tough job to stay sober in today's environment and to keep your wits about you, because there's so many mad things happen, like whether you agree with them or not, things like Donald Trump being president of the US, whether or not you like him or not, he's very controversial. And we had for the last few years we've had non-stop about Brexit, And a lot of people, some people support Brexit, so I'm not saying either way whether you support or against, but it's a very divisive issue. And now we have the coronavirus. Like, if I was still drinking nowadays during the environment over the last few years, I don't know if I'd still be alive, because like being sober is about your behavior and staying in touch with reality, I think. And when there are all these big divisive things happening, I think it's very challenging to kind of stay sober, and just to look after yourself,
I,
uh,
yeah, I agree with you. It is a very challenging world, but I think we mustn't lose sight of the positive. I mean, yes, the likes of Brexit and President Donald Trump, is an affront to democracy. But the COVID crisis is actually changing people's attitudes towards government. It's changing people's attitudes towards big business being the be-all and the everything. We're seeing a huge sense of community emerging, and people are starting to value the real things like matter, like being connected to people, like love, like having time to enjoy being with people, and this mad rush of just spending. People can't really spend. So I think there are positive there, and I think for people who are challenged and feel really afraid of what is going on, in every generation there's huge crises. There's huge issues. But the fact is, globally, people are living longer. There's no doubt about that. Lots of people have been lifted out of poverty. So there are lots of positives as well. I wouldn't get too focused in on all and they are very negative things, but there's lots of positives happening as well.
Yeah, and we were talking about alcohol abuse there, and I've spoke to you several times over the last few years about alcohol abuse, Carl. At least now, since the end of 2018, we have the Public Health Alcohol Act, although I believe most of it has not been enacted yet. Problem gambling is a huge problem also in Ireland today, Carl, isn't it?
Yes, it is. And what we're seeing is that it's not a regulated area, and we're seeing that the industry has moved online. My feed is filled constantly with emails, with advertisements, inviting me to get online. And we have no safeguards against it. And it is one of the big issues for democracies that we allow big business to manipulate people and to make out that people are the problem rather than the way people are being marketed to and the way they're being enticed. So to give you an example, to open up a gambling account is very easy. You can do it in minutes. To close a gambling account takes a lot of people at least half an hour to close a gambling account. They use all kinds of strategies to stop you closing them. And the Public Health Alcohol Act is very welcome, but as you say, it hasn't been implemented. And I don't think it's because Minister Simon Harris isn't passionate about fully implementing it. It's simply the amount of opposition within his own cabinet. Some TDs and ministers in the current term actually had wine tastings in the Dáil, which seems incredible that this psychoactive drug is being promoted by our own government. Big alcohol has so much influence that they just don't, unless society changes and society says, we want you to run a government that benefits people. We don't want you to run a government that actually favours big business. And we see this even in housing. Our housing policy is dictated by business rather than housing being a human right. So there's kind of an ideology, a way of thinking which says, big business is good and people's rights not so good. It's not a priority as such.
It was a great achievement getting the Public Health Alcohol Act over the line, wasn't it? Now it's just a question of implementing it in full.
Well, it was a great achievement, but what is really disappointing is that the Act was finally passed in 2018. We still don't have a date for when it's going to be implemented, and a number of deadlines have passed. It's still not being implemented, and even in early March there, where the Minister gave a very good speech at the Global Alcohol Policy Conference, which was held in Dublin Castle, there was no commitment to actually implementing minimum unit pricing. And if we had it now, there would be a lot less damage being done, because people would be buying the drink that has less alcohol in it. So they're doing less damage to themselves and also to their families. Like over 200,000 children are harmed every year by their guardians or their parents drinking alcohol. And because of the lockdown, those children have nowhere to go now. They've no schools, they're not meeting their teachers. So delaying implementing that was a really bad call. It's not going to happen, I don't think, at the present, because the whole focus is on COVID. But really, we'd have a lot more hospital beds if we had implemented the alcohol public health bill. And I would hope that would be one of the things that will come out of this crisis, that we see that government should govern in the best interest of people and public health. We need better public health systems. We can't just see it as a minor issue. It's a major issue.
It looks like the next government is going to be formed over the next few weeks or months, and it'll be Fianna Fáil, Fine Gael. There could be another small party. So hopefully it'll be in their programme for government that they're going to implement it in full. Okay, Carol, to come towards the end of the interview, do you want to tell our listeners anything about any other news or things that we should look out for as regards your work over the next while?
Well, I think one of the things that we're campaigning for is actual regulation of addiction services. Your listeners might not know, but there is no independent regulation of addiction services. So if you want to get a residential addiction treatment, a lot of the time you actually have to go to Mass every day. You don't have a choice. So it really shows the lack of thinking.
Isn't it?
Yes, yeah. And it's not just Coonvera. In one of the other places, it's the same. So it shows that people who are looking for help, very vulnerable people and their families that are looking for help, they're not getting best-in-class treatments. And there's still so much stigma around that. It is acceptable for the government to fund a service where they're not measuring outcomes effectively and where they're abusing people's human rights by insisting that they have to go to Mass every day. Like, it sounds crazy that in this day and age that is still the case. We also have the Scientologists have finally gone through all the planning permission barriers, and they've got planning permission to open up a residential treatment centre in County Meath. Now, that's Scientologists have... Yeah, it's a cult. It's really incredible that as a society we're allowing this to happen. It's like we're saying to people with addictions, you don't matter. You're responsible for your own problems, and we as a society, we don't care about you. That's the message that people with addictions get all the time. And then because they're getting this message that they're worthless, that they're not worth anything, they accept those type of treatments and they start acting out. And you see more and more of the challenging behaviours. Whereas when they're treated with respect, when their human rights are respected, they can actually recover. And this is the key thing, that as a society, we don't seem to care enough to protect these very vulnerable people, whether it's COVID, whether it's getting Mass and addiction treatment service, whether it's going to a service which, is bunk and is a cult. So I call on your listeners to maybe, people with addictions often can be very, very challenging to deal with, but it's to try and understand nobody chooses to be addicted. Addiction is always caused by pain. It's always caused by trauma, and we're beginning to see some services taking that on board. So look for the services which have what's called a trauma responsive approach. So they're trying to figure out what is going on for that person that they're choosing to engage in substance abuse, because they're trying to mask some kind of pain. I'd ask your listeners maybe to consider that.
Okay, Carla, I won't keep you all day. We spoke about this in our last interview as well, 6 months ago. And it is recognised, including by the big book of alcohol or the big book of mental health, whatever it's called, that or addiction issues are mental health issues. Do you agree with that, do you?
Yeah. Yeah, the DSM, which is the Bible for the psychiatrist, it specifically says that alcohol and substance abuse is a mental health issue, but because historically the way systems have developed and then vision for change was flawed in this approach, they've become two totally separate areas. And we would strongly argue that unless you solve the underlying mental health issue, which can be trauma, emotional pain, physical neglect, emotional neglect as a child, or grief, bereavement, unless you actually tackle those issues, you're not going to solve the addiction. You've got to focus on the emotional pain behind it. And having all of these services which treat them as separate issues, it's more expensive to run separate services, and the outcomes for people using the services are worse. So it does not make sense at all.
I think there really needs to be a lot of awareness or education increased on that addiction issues are mental health issues,
Yes.
I think there's a huge gap of knowledge amongst the general public as regards that, Okay.
Yeah.
Okay, Carol, it's great talking to you. I'll be talking to you again on the FM over the next few months, right?
Okay. Thanks very much, Darren. Bye.
Right, thanks,
Bye.
Bye.